Step one, do a breath test. You can have digestive issues for a lot of different reasons. Doing this breath test is what I found to be the best option for most people. I feel like in recent years, because there's studies that look at breath testing and some say, but it's a bad test. You you can't trust the breath test to do this. And this can be true to some extent. It is something that we've noticed that using glucose as a sugar substrate tends to give a higher rate of false negatives on breath testing, which means false negative means that you have SIBO, but the test does not identify it. So for that reason, I do tend to prefer using either lactulose or fructose. I've switched in my practice to using fructose more frequently than even the lactulose recently. There's a few nuanced reasons for it. Basically, there's a fewer incidents of false negative with using the fructose, and I'm basing this off some research that Dr. Jason Hurlak did. He's a practitioner out of Australia, and he took his patients and he had them do 3 breath tests, 3 consecutive days. He did glucose day 1, fructose day 2, lactulose day 3, and he kind of analyzed which tests were coming up as positive for glucose, fructose, and lactulose. Fructose seemed to be the best by a little bit of margin over the lactulose, and glucose happened to be the worst. So that's the reason for that explanation. So doing a breath test is first. One more thing I'll say on breath tests about people that say you shouldn't do them, you shouldn't trust them. This is the best tool that we have right now to identify SIBO. There's nothing else. And we've also found through some of Dr. Pimentel's research over the past year that they specifically did a couple studies that looked at, hey, when the breath test readings are higher, how many microbes that produce those gases are actually in the intestine. And there was a direct correlation between this for each of them. That's a good example that if you see the numbers on the breath test are higher, there's a good chance those bacteria are there. And I've also noticed through working with people that when the breath test levels are higher, their symptoms are worse. This is almost always the case. Like I've had tons of people where we've done a breath test, they had really high either methane, hydrogen, whatever gas, and they said, I felt terrible doing the breath test. And then maybe later we did a follow-up one, and the patient said that they have no symptoms doing the breath test, and they felt way better. I'll show you a quick example right here. This is FoodMarble results. This is from a patient that I started working with a couple months ago. This test is from January 2025. This is, like I said, FoodMarble results. The methane's in this really dark blue. He had, it looks like, up to 13 parts per million on the methane. I take anything over 10 throughout the 3 hours is technically diagnostic of methane, especially if there's symptoms caused from that. And then the lighter blue is hydrogen, which I take usually up to the 120-minute mark, a rise of 20 parts per million hydrogen. Looks like he started out at 3. Yep, 3 right up here. And then it got up to 40. That says 40. Oh, they're measuring the difference. That looks like 46. So he had combined methane and hydrogen SIBO. This is the test result that we just got back yesterday, and he's been doing good. So we're under 10 on methane. Hydrogen, he had a rise of under 20. It looks like it only went from 2 to about 15. So less than 20. He had no symptoms during this test. This is one example, but that's what I'm talking about. It goes to show you feel better when the gas levels are lower. Do your breath test. It's the best technology we have right now. Trust it. All right. Did the breath test for analyzing the results. I talked about them briefly on FoodMarble. FoodMarble, you can get like a official number scale like I just showed you, but you can also get a 0 through 10, which you can see if you're not linked to a certain practitioner. Essentially, for each number 0 through 10 that you get, multiply it by 5 and you'll have the parts per million. For example, if your methane is a score of 2.0, that's right around a 10 parts per million. This isn't completely exact, but it gives you a very good jumping off point. If the number is 10, it's at least 50. It's pretty darn high. Whatever it is, you know you're probably going to need to treat it. So it doesn't have an exact number to give you. Like if it's 90 parts per million compared to 200, you won't know that specifically. Okay, so talking a little bit about scores, as I mentioned, looking at the hydrogen, we're looking at a rise for hydrogen of 20 parts per million over the baseline. So if your baseline hydrogen is 3 parts per million and the hydrogen in the first 120 minutes jumps to at least 23 because it's a 20 parts per million rise, that would be diagnostic of SIBO. If the part per million to begin is 25, you're going to want to redo it because that's too high to get an accurate reading. But if you start at a 25 and then it reaches a 35, at the 120-minute mark, then we don't really know for sure. I'd say that's more inconclusive. We don't know what the situation is with that. Methane, it's a little bit more straightforward. If you're hitting over 10 parts per million, especially if you have symptoms like constipation, bloating, we consider that, or I consider that to be positive. Hydrogen sulfide SIBO, it is not measured on the FoodMarble device, but if you're getting a hydrogen sulfide gas over 3 parts per million, then that's indicative or diagnostic of hydrogen sulfide. Dr. Pimentel did make a video sometime this past year saying that he's really pushing to have this reduced to 2 parts per million because he's seeing a lot of symptoms for people that have 3 parts per million, or excuse me, he's seeing a lot of symptoms for people having 2 parts per million hydrogen sulfide, and they're really having a hard time. Another thing we can look at for hydrogen sulfide SIBO, it's not as accurate, but something called a flatline test. So if you have really low hydrogen and methane, I have on here under 6 parts per million hydrogen and 3 for methane. This should more be like closer to 0 to 0. I probably should update this, and I will. Even then, it's not like a super accurate measure where you can trust that it's hydrogen sulfide SIBO. But just wanted to mention that. Next